Good day, everyone. I'm Justine Caliva.
And I'm JC Rufino, and today we will be discussing about Salmonella. So for our report overview, we will be discussing about the description, pathogenesis, and epidemiology, and research and therapy for Salmonella. Salmonella is a microorganism that can be pathogenic and commensal for humans and many animals. It can cause disease if acquired orally. They are typically transmitted through contaminated water or food from animals and animal products to human. Medically, Salmonella is important because it causes enteritis, systemic infection, and enteric fever.
Salmonella, known to be a unicellular organism, belongs to the kingdom Bacteria. They are under the phylum Proteobacteria, which consists of the gram-negative bacteria. Moreover, they also belong to the class Gamma Proteobacteria. They also belong to the order Enterobacteriales and family Enterobacteriaceae. To this date, there are two known species of this genus which are named Salmonella enterica and Salmonella bongori. Salmonella are rod-shaped, non-spore-forming, facultative with varying lengths. Salmonella have petricus flagella. As reflected in the picture below, petricus bacteria possess multiple flagella that grow at any point of the cell body, which allows this specific bacteria to move. They can also survive in freezing water and are resistant to certain chemicals that do not permit the growth of other enteric bacteria. These compounds include brilliant green and sodium tethathionate. Including these chemicals to agar media can be used to select and isolate Salmonella species. They were originally classified according to the different aspects. They are known and italicized as binomial nomenclature Salmonella typhi, which should be emphasized that is wrong since typhi is only a serotype and not a specific epithet. They were first subdivided into 7 subspecies. The two species, S. enterica and S. bongori, were formerly classified as subspecies 5. The S. enterica subspecies 1 is the usual cause of most human illness by Salmonella. Lastly, Salmonella can be classified as either typhoidal or non-typhoidal. Typhoidal serotypes are those that cause typhoid fever. Salmonella can be described differently when cultured into different culture media. Salmonella colonies can thrive even in a simple agar. In a nutrient broth, Salmonella produces turbidity. In a nutrient agar, on the other hand, they can be described as translucent, opaque, smooth, and circular. McConkey agar is a selective and differential to non-fermenting gram-negative bacteria. MC agar produces colorless colonies of Salmonella, which tells us that they are non-lactose fermenters, gram-negative colonies. In a Salmonella agar, on the other hand, the colonies are circular with black at the center indicating their presence. Salmonella is an anaerobic bacteria. They can survive where the oxygen is absent. Moreover, its carbon source is citrate while its nitrogen source is from lysine. During human infections, Salmonella uses glucose as an energy source for growth and reproduction. As explained in the MC agar, they are almost non-lactose fermenters as well as non-sucrose fermenters and oxidase negative. They also ferment glucose and mannose to form acid and sometimes hydrogen sulfide gas. For their niche, Salmonella is most commonly found in the intestines of humans and farm animals, so it can survive almost anywhere, including in soil and feces, as long as there is organic matter.
Now, moving on the pathogenesis and epidemiology. As for the route of infection and transmission, non-typhoidal Salmonella can be acquired from many different animals as well as from the environment. Many animals harbor Salmonella naturally in their intestine without obvious disease, and animals that typically carry Salmonella include food and farm animals such as poultry, pigs, cattle, and other pet animals. On the other hand, humans acquire the bacteria via the oral route, and thus the sources of infection include fecally contaminated water and food. Moreover, transmission occurs from either a carrier or an infected person to others. These carriers include feces of people with unsuspected subclinical disease and people working as food handlers. Likewise, it is well known that high incidence of Salmonella came from commercially prepared chickens. There are 3 main types of disease in humans produced by Salmonella. The first one is the enteric fever, also known as the typhoid fever, which is a severe systemic illness caused by Salmonella typhi or Salmonella typhi. As for the signs and symptoms, enteric fever has an incubation period of 10 to 14 days. After this period, high fever of 39 to 40 degrees Celsius, malaise, headache, diarrhea, constipation, abdominal pain, bradycardia, myalgia, enlarged spleen and liver manifest. Rose spots in the chest and the abdomen are also seen, as well as normal to low white blood cells. The next is the bacteremia and vascular infection that occurs in approximately 8% of patients with non-typhoidal salmonella infections. Its symptoms include rapid rise of fever, spiking septic temperature, infection to vascular sites, and persistent high level of bacteremia or bacteria in the blood. Last is the enterocolitis, which is the most common manifestation of salmonella infection. After the incubation period of 8 to 48 hours, nausea, headache, vomiting, and profuse diarrhea of 3 to 7 days would manifest. There's also a low-grade fever of 38 to 39 degrees Celsius and abdominal cramping. Presence of leukocytes in microscopic stool examination can be seen, along with inflammatory lesions of small and large intestine. The incidence and mortality of enteric typhoid fever due to Salmonella typhi and paratyphi vary significantly by region. Low rates are in developed countries such as the United States, Canada, and Western Europe. On the other hand, over the past decades, reported cases of Salmonella infection has increased worldwide, especially in third world countries. Detection methods for Salmonella include specimens such as freshly passed stools, blood, bone marrow, urine, or intestinal secretions, which are the most common and widely used method in the laboratory diagnosis of Salmonella. Other detection methods utilizes bacteriologic methods of isolation in Salmonella, as well as serologic methods and nucleic acid amplification. For the therapy and research, in treating diseases such as Salmonella, antibiotics are widely used. For uncomplicated enteric fever, oral azithromycin is prescribed. For patients with complication, hospitalization, third-generation cephalosporin, fluoroquinolone for at least 10 days are also prescribed. For non-typhoidal Salmonella, bacteremia, third-generation cephalosporin and fluoroquinolone is given, whereas endovascular infection is treated with intravenous ceftriaxone, ampicillin, fluoroquinolone for 6 weeks. For severe diarrhea cases, replacement fluids and electrolytes is essential. For susceptible organism, oral therapy with amoxicillin, trimethoprim sulfamethoxazole, or fluoroquinolone is advised.
Fluid intake is highly advised to replace the fluid loss due to diarrhea for mild cases. For the cases that are more severe, hospitalization and IV fluid might be needed. To avoid antibiotic resistance, antibiotics can be used for treatment but only for vulnerable patients. For the prevention of the spread of bacteria, sanitary measures should be practiced. Personal hygienic precautions must always be observed for food handlers. There are also vaccines available to fight salmonella infection, which are called PY21 vaccine and VICPS. Vaccines are advised especially when visiting other endemic places. Just this August 2021, there has been a report of a case of acute infectious pancreatitis associated with Salmonella typhi. Pancreatitis is usually caused by alcohol use and lithiasis, so its association with bacteria Salmonella is considered as a rare complication. The patient had diarrhea, vomiting, and severe abdominal pain. CT scan showed pancreatitis. Because of the presence of diarrhea and abdominal pain, the doctors thought of possible Salmonella and ordered blood and stool culture tests, which consequently tested positive to Salmonella. This will be all for our report on the bacteria Salmonella. Thank you.